Quite a few diseases can cause back pain. Usually to determine which type, the doctor is going to ask you a bunch of questions about the types, symptoms, and then they'll also ask you how long. Acute back pain is 4 weeks or less. Chronic back pain has been going on for 12 weeks or more, and then subacute is in between. In addition to this, we'll ask quite a few questions about the type and nature of your back pain, and we'll also perform a physical exam. Now, most causes of back pain are benign, which means non-serious. Think about muscle spasms, back spasms, sprain during lifting, heavy exercise, chores. Sometimes improper posture can also contribute to the development of back pain. There are serious causes of back pain as well, and there's multiple categories of those. Ankylosing spondylitis, also known as axial spondyloarthritis. This is a disease that often happens to younger males, and they'll present with morning stiffness that improves with exercise. They'll have alternating buttock pain, and sometimes they'll wake up in the latter half of the night due to pain. Think of compression fractures. This often happens to older women who have osteoporosis. They'll be moving around, just going about their regular day, lifting, doing their chores. They may often hear a sound that precipitates the acute onset of pain, or their pain may not be that severe and they just keep working with it, but it never goes away. This often happens to women who have osteoporosis, which can be a common occurrence in women as we age. Then the other diagnoses to think about would be spinal cord compromise. So this happens due to spinal bone disease, injury, and trauma, and patients will often present with difficulty with ambulation. They're having trouble walking with their gait. They're developing a numbness around their groin area. They may have trouble with urination, and in some extreme cases, they'll develop fecal and urine incontinence. Now, we also have infectious as a cause. So IV drug users have a risk of introducing bacteria into their bloodstream that can cause infections in the heart and in other parts of the body, including the spinal canal and the disease there. There are also patients that have chronic hemodialysis catheters, and these catheters can also increase their risk of developing a bloodstream infection, which can also cause infection in other parts of the body, including the back. And then finally, we also think about cancer. Now, cancer patients, those are patients that are going to have either an active history of cancer or have risk factors for cancer that hasn't been diagnosed yet. And they'll have this back pain. They're taking medications. Nothing is making it better despite the usual treatments. They're losing weight. There's other signs. Now, what the doctor will do is, after a thorough history to try to ascertain and get all the details, they'll also examine your back, and then they'll make a decision about whether or not an imaging test is needed to manage your back pain. And that will be my next video, which will cover imaging. So until next time.